so excited to have Dr. Millie Lytle here today to talk about how to track your symptoms without getting stressed and overwhelmed. Welcome. And can you just let the audience know a little bit about yourself, where you live and what is your relationship to arthritis and autoimmune disease?
Sure. Well, I'm the head of coaching at Mymee, and we are a program that provides support and help to people and in identifying their triggers. So I've been doing this full time for the past 3 years. And prior to that, I was working in practice as a naturopathic physician. For those of you who do not know what a naturopathic physician is, I did my pre-med, and then I went to a 4-year postgraduate private medical school that focuses on holistic medicine. So in addition to studying medical sciences, how to assess the body, physical and clinical diagnosis, I also learned about treating the body with nutrient deficiencies, supplementation, herbs, homeopathy, clinical nutrition or orthomolecular medicine, diet therapy, as well as acupuncture and kind of the whole gamut of the holistic world we covered. And so depending on what state the naturopath is residing in, they might have gone through the 4-year postgraduate, or they might have taken an online program. So not every state licenses naturopathic doctors. So you want to find out, how your naturopath was trained, if they're licensed, and it really does depend on the state. Not only that, naturopaths go by different nomenclature or titles depending on what state they're living in. They might refer to themselves as a naturopathic physician or NP. Personally, I'm licensed in DC. So in DC, I am an NP, whereas I usually refer to myself as an ND because where I went to school, that's how we refer to each other. But then there's also NMDs, natural medical doctors, and it's the same training. But if you're in Arizona, that's how they refer to them there. So it is very confusing when you're shopping around for a holistic team because you really do want to investigate a little bit more as to what people's backgrounds and educations are. But I could say that if you want to know nationally which state licenses naturopaths, you can go to the AANP, not to be confused with the American Association of Nurse Practitioners, the American Association of Naturopathic Physicians.
That's super helpful. I honestly think, especially when you're newly diagnosed, a lot of people refer to it as a time of like alphabet soup, where you're like, there's all these shortenings for the conditions. There's like PSA for psoriatic arthritis or RA for rheumatoid arthritis. But then some people refer to it as rheumatoid disease, or it's a rheumatic disease, but it's also inflammatory arthritis, but it's also autoimmune arthritis. And then not even to start with all the spondyloarthropathies like axial, radial spondyloarthropathy, or there's non-radiographic axial spondyloarthropathy, so yeah, that's just in the conditions. And then there's the different kinds of providers, there's physical therapists, and then there's physical medicine and rehab doctors. So anyway, not to go on too long about that, but just thank you for that overview, because I think it's an area of confusion when you hear naturopath. It sounds like what you're saying. There's definitely a variety of training and a variety of degrees people could have, and a variety of different legal abilities they could have in state to state. I know in Washington state, I live near actually Bastyr University, which is like a great, holistic training facility for why can't I just call it, like, what am I trying to call it? It's school for people to become naturopath.
Naturopathic school. Mm-hmm.
Yeah.
It's the first naturopathic school, actually. It's the first one.
Oh, wow. Yeah. And in our state, it's definitely that could be your primary care person is a naturopathic physician in Washington state. So you have to know, it sounds like, look up on the AANP, not the nurse practitioner one, but for the naturopathic practitioners. Thank you for that overview. And I think.
Absolutely. And
Oh, anything else you want to say?
I just wanted to say where I am. I'm in Florida. I live on the Gulf Coast of Florida, and this is an unlicensed state. So naturopathic doctors aren't licensed in Florida. I came from New York, which is an unlicensed state. And so that's why I do keep my license in the District of Columbia, because they have a good license. We're licensed by the Department of Health. And so it's kind of integrated into the medical system there, so to speak. And I came from Canada, where we were licensed there as well. So, depending on where I move, I find that I've had to change, my interpretation of what I am and what I do and what I can do.
Wow.
But now I just practice remotely. It's all remote now. So
I know that is Yeah, that's one of the great, I mean, trying to find silver linings in the pandemic, the increased access to remote care has in virtual care. I mean, it's helped on many levels. For me, just even the logistics of planning, okay, I see a doctor, I'm in the suburbs and I see the doctor in Seattle. Oh, I have to plan my trip and, the parking and if my appointment runs late, I need to arrange childcare for my child. Now it's like, it's a lot of those logistical barriers have been removed with telehealth. So that's helpful. Yeah.
Yeah. I mean, it's pros and cons. You want to see somebody in person sometimes. You want to have somebody look at you
Oh, yeah.
physically, but it is very convenient to be able to call somebody. So
Yeah. Yeah. Especially with like ongoing chronic conditions where you may just need that check-in or maybe questions about, side effects or whatnot. But yeah, I definitely have gone in person numerous times to my rheumatologist, especially I need her physical exam. She could really tell the difference between different degrees of swelling and stuff, even more than me. It's hard to self-assess your own body sometimes because, even the way you touch yourself, you're feeling that feedback, right? From the inside out and the outside in at the same time. I personally find it's kind of like how you can't really tickle yourself, it's hard. You need an outside perspective sometimes, but okay, I got to keep myself on track. This is why I do an outline before each episode. Believe it or not, those listening, I do an outline. And, I think symptom tracking, as somebody who's lived with a chronic condition, numerous chronic conditions for 20 years now, it's definitely something that is like so helpful to make sense of why your symptoms maybe are a certain way in certain conditions and a different way in other conditions, but sometimes it can be overwhelming. But in general, can you explain to somebody maybe who isn't familiar, like, what do you mean symptom tracking? What is symptom tracking and why is it important?
So you might find that whether you've just been diagnosed, you've been struggling for a long time, or you have not been diagnosed as of yet, there are symptoms that you have pretty much day in and day out. They seem constant. Some of your symptoms might only appear at specific times. So first thing in the morning, to a lesser degree throughout the day as you're up and moving around, or after you've been moving around, you might find your symptoms appear more. And then other symptoms might appear sporadically. So there is a difference when it comes to symptom presentation as to whether, you might want to consider tracking those symptoms or not. And so not every symptom presents the same, and that can give us clues into helping ourselves deal with some of those symptoms, or even kind of drilling down into triggers or maybe what's causing that symptom or how to anticipate that symptom might come about. That's kind of what we start with at Mymee, is looking at symptoms that are not constant, because if you are going to track, now you did ask me to explain what tracking is. So tracking is just logging essentially when you're experiencing that symptom. And you can use any method of your choice that's reliable to log. You can do pen and paper, you can mark it on a calendar, in a journal, you can draft your own spreadsheet and become very meticulous. And of course, now there are numerous apps that allow you to track your symptoms or your day-to-day experience, and not just your symptoms, but more as well. So it's essentially just capturing the time, the place, the symptom itself, or any detail around it as to, what you're experiencing, so that you can puzzle piece for yourself. So you can kind of be a detective and identify, oh, this is happening now, or this happened, last week, or this happens every day at this time. Isn't that interesting? I didn't realize before that it happened always at this time, or always in this place, or it's very random that this happens. And so I really want to try to understand if I can find, I want to see if I can find out any more information about when this is happening. So I'm going to track it and see if it correlates with anything else in my life. So
Yeah. And I think
there are
the first thing people usually anchor everything around is time, right? This day, that day, this time of day. And then you go on to track, write down whatever it is that's important to you that you want the outcome to be. Is it pain? Is it fatigue? And you also track different kinds of activities that you think maybe contribute to that to that symptom. Like, let's say I'm concerned that every time I eat dairy, I might be experiencing bloating and joint pain. Then you would just kind of say, okay, time, ate this, bloating, X amount, right? Is that kind of, am I describing an example correctly in your mind? Expertise?
Yeah. Yeah, you can start with a hypothesis. So it is good to have a goal with your tracking. So the reason that I'm going to track now is to understand if anything that I'm eating or anything that I'm doing or anywhere I'm going is contributing to this symptom. And so then you start to track all the details that you can think of kind of around that symptom happening. And if you can narrow in on the time frame between having done something and having experienced the symptom, then you can kind of start to recognize patterns. So it is good to have, a reason or a goal in mind as to why you're tracking. Some people just might want to start tracking. They're just interested. They want to quantify themselves. But it does, if you're going to do that in the long term, it takes a lot of coordination and patience and persistence. And,
Yeah.
it's a lot to track, especially if you're tracking everything or the more details you track. I think it can become really quite stressful potentially, especially if you're wanting to keep yourself accountable to tracking everything without knowing what it is that's actually participating in that symptom. And if you're even on the right track towards, finding it, or if there's something else that you just haven't thought of or are missing. So
Yes.
having a goal is a good idea. I think you can have a hypothesis or you can not have a hypothesis. So you can have already had an idea or a hunch that, I do think dairy is a problem. Now, maybe it's some dairy, maybe it's not all dairy, or maybe it's an amount of dairy, it's not any dairy. So there's also thresholds that come into play. So I can eat, a serving of milk a day and not feel pain. But if I then eat 3 servings of milk, then I'm in trouble. That might be, a hypothesis, or you just might be, okay, I want to know if every time I eat milk or eat dairy, if I'm going to have pain or not, and just follow yourself until you kind of find some patterns. But you can also start without a hypothesis and really not know what it is. Like, I have no idea what is causing this pain. I wonder if it's associated with anything that I'm doing, and just try to leave yourself really open and curious about finding out what it could be.
Yeah. Yeah. And I think in that case, the goal could simply be communication with your providers or your medical team to kind of say, okay, because that's, I think some chronic illness patients in the beginning, they kind of get taken aback when they're asked to rate, in the last 3 weeks or the last week, how bad has your pain or fatigue been on a scale of 1 to 10? And it's like, wait, I don't know. And then we kind of have this like recency bias, right? Where we're kind of more likely to share information that we can easily retrieve from our memories in the last couple of weeks. So being able to have a bit of data to go from can help you even if you're not sure about variables correlating, if you're just trying to kind of capture your overall progression of your disease. Or, I think a lot of times with medications, this is also something where, it's helpful to say, okay, I'm starting to think that maybe my medication plan isn't enough. Like, I'm feeling more stiff. Let me kind of, if you have that baseline to go from, like, yeah, when I first started the medication or lifestyle factor, whatever it is, my intervention, I was feeling like at a 2 out of 10 on stiffness. And now I'm kind of more like a 4 or 5. And I know those listening will know I've said this before, but it's very, very, very hard, I think, to put numbers on these phenomena in general. So, moment of empathy for anyone who's like, I've joked before, I think even on the podcast, I can't remember, but saying like, if someone asked me to rate my pain on a scale of 1 to 10, it's like asking like, what color is love? Like, I don't even like those numbers in pain. Like, it's hard. So anyway, I guess question for you is, like, how do you help people, or have any tips for people to like conceptualize, like how to quantify some of this stuff?
Yeah, we actually help people quantify by suggesting they qualify it, because the pain
Oh,
intensity scale, I'll talk about it. The
I'm
pain
excited.
intensity scale, the pain intensity scale is a tool that's used by every single rheumatologist and most doctors. And, it's a necessary part of an exam, if your physician's trying to examine you and understand how much pain you're in, they're going to ask you to rate your pain from 0 to 10, 0 to 100, with 100 being 10 being the most pain you've ever experienced and 0 being no pain. But if you're experiencing, and similar to what I was thinking of when you were speaking, was that if you're in a level 3 pain constantly, then that pain is all of a sudden going to escalate, because I can tolerate a level 3 for a short period of time. It remains a level 3. But if you're in a level 3 pain for 48 hours, for 148 hours without relief, then that's not a level 3 pain anymore, and because there's no relief from it. And so anything that there's no relief from, that's why is not going to be a low grade pain. It's going to be, a chronic pain, and you're going to experience it as unremitting or relentless even. So then it all of a sudden becomes, a much bigger deal in not just your mind, but your body as well, and the way you experience it. Because pain intensity is also, the level of intensity we experience is also over duration. It's not only just in that acute moment. And if you're in pain in that acute moment that the physician's asking you, then it's going to be a different level than if you're not in pain in that moment as well, because you're clouded by the pain that you're currently experiencing. And then there might be other things about just relating to physicians, which are difficult, which also might make us answer those questions, in a way that's not always. It's not an objective question. It wants to be an objective question, but it's not an objective question, because our 0 to 10 pain scale does not always remain the same, because we are human beings. So at some times, actually an 8 might be a lot more than an 8 and other times, just depending on a whole lot of other factors that might be discomfort in other ways. And so at Mymee, what we do is we have clients qualify their pain. So, for instance, what does an 8 mean to you? What does a 3 mean to you? And so if you're thinking about, okay, well, sometimes I have mild pain, sometimes I have moderate pain, sometimes I have severe pain. So even if you break down the pain scale into 3 areas, mild, moderate, severe, what is that mildest pain? Like if you have a good pain day and it's a mild pain, because maybe you're never without pain, possibly, hopefully not, hopefully you do have no pain days. But if you're having always pain days, what does that mild day feel like to you? Versus, and maybe that feels like an inability to do certain things, like maybe an inability to do exercise, for instance, on a mild pain day. Or maybe that feels like, aches in certain areas of your body, like in your joints, but it doesn't extend to the full body. Or maybe it includes, maybe it doesn't include rashes or any other kind of exacerbating symptoms. Whereas a moderate might feel like occupies like half of your body, or you feel it inside and outside, or it's not only an ache, but it's also a shooting. So this is for everybody to get more specific. I'm not telling you what a moderate is for you. This is something that you can come up with on your own, that you're really honing in on what that 5 is to you, or what that 6 or 8 is for you, so that then you can attach that number, if you will, to the actual experience of, in a kind of objective way. You are creating an empirical value from an experience, a qualitative experience. Whereas, on a 10 day, you might not be able to get out of bed. I mean, your body, just doesn't move. So that's kind of how we approach it. And I think it's a really helpful way.
Yeah, it's really, really congruent with my training, like as an occupational therapist. Like we are all about what is the person's ability to participate in daily activities and required daily tasks. And when you look at participation, it's informed, and participation is just the doing of stuff, whether that's walking the dog, making food, eating food, taking care of children, or and pets. I'm thinking of my pet right now, and you have a puppy too. It is informed by the contextual supports. It's not just, if I have severe, moderate to severe pain, but I have maximum supports, environmental supports in terms of people that can help me, let's say, perform cooking tasks so I don't have to, or help me with childcare, then my participation is not going to be as limited as maybe if I had mild to moderate pain, but zero environmental supports. I don't have help with childcare. I don't have help with, household management. Don't have help with finances. That's a huge part. So if you just have, looking at, what is my pain on a scale of 1 to 10, kind of tells you practically nothing about my ability to function in daily life, other than on a very gross level. Like typically somebody who's at a 2 is not going to be able to function with as much ease, or is going to be able to function with more ease as somebody on like an 8 or 9. But I feel like there's just that entire gray area between like a 2 and lower and an 8 and higher is like practically sorry, I feel like I don't want this to become a soundbite where someone's like, Cheryl says it's like pointless to rate your pain, but it's just so limiting in terms of, if your goal is to improve your quality of life, then you can't just look at a abstract number that there's zero inter-rater reliability anyway, if you're looking from a statistical standpoint, right? Because no one will ever know what the 5 feels like to you other than you. So I love your idea of, okay, let's start there then. What does it mean? I don't know if this is what you were getting at, but I know some people in occupational therapy, or they're just patients on their own, have figured out, let me just say what I can and can't do due to my pain and fatigue. So right now I can't do X, Y, Z. That's actually what I tell people sometimes, or advise people to communicate to their doctors. Say, people come to me and say, I can't do my bra. I can't, tie my shoes. So I'm like, tell your doctor that, because maybe your pain or stiffness is only in your head, you're saying it's a 3 or 4 out of 10, but it's preventing you from functioning in daily life. And your care team will want to know that that's a severe limitation on your ability to kind of function. Right. So sorry.
Yeah, exactly. And there are, no, absolutely. And that is definitely one way to think about pain and or stiffness or mobility issues, and anchoring that to a number if you wish. I mean, you don't have to anchor it to a number, but it is a way of saying, on a 3-day, I can take care of my children, whereas on a 6-day, I can't even I can't even take care of myself. I need somebody to help me. And so whatever that means to you. So and you can look up abilities questionnaires or, activities of daily living, and kind of like see what the medical profession considers like that list. Are you able to do household chores? Are you able to feed yourself? Are you able to dress yourself? Are you able to bathe yourself? And some of these questionnaires tend to go into kind of the geriatric field a lot, but even injury. But in any case, it can be really, I think, instrumental just in that being aware as to what those abilities and abilities are for you when it correlates to a certain level of pain, and the physical function as well, which is also a type of questionnaire, just a direction of it's another way to think of can I move around the way that I want to? Can I do my shopping? Can I sweep my house? Can I vacuum? Can I walk the stairs? Things like that. So tying that to pain, I think can be really helpful. And even just, and what you said, to communicate with your doctor, as well as just to be aware of yourself, anchored in yourself, because that's another, maybe a prime reason to track is to build your own body awareness. Obviously, you're very aware. Most people are very aware of their body, feeling like crap.
Yeah.
But the subtleties around that, and when it feels better and worse, can really inform you a lot about how your body's behaving that day.
Yeah, I think like this is where I get a little bit in a little bit of circles, but maybe just me sharing the circles will help other people who are struggling, because I have actually worked in therapy as the patient with the psychologist on like being able to accept that sometimes I have done, like, my academic mind has reached a point where I've done everything I can to try to understand this. And I'm jumping ahead, right, to maybe advanced levels of tracking where you're like, okay, I'm using all my hypotheses that are informed by my life experience and my understanding of my condition. And then there can be times, right? And maybe tell me if you disagree, but where you just, I like to joke like a butterfly flaps its wings, in Asia, and then I get a flare up. Like sometimes there is a randomness to it that I found it useful to, like, from just a peace standpoint and acceptance standpoint, to say like, okay, this, like, forgive my French, but like shit happens, like, and I can actually say, okay, well, sometimes I'll get my expectations set to where, like, you mentioned the word curiosity earlier. Like I'm approaching the symptom tracking from like a curiosity, and I find that more mentally healthy than what I've seen other people do and myself at the beginning do, which is this anxiety and almost obsession of like, okay, I just got to track everything and I got to get everything written down. And then I'm going to find all the variables, correlate them, and then my life will be better. And do you see people go through that kind of evolution, or I don't know if there's a question in there. I'm just sharing how it can be a double-edged sword. Let's put it this way: super
Yeah.
empowering to
Yeah.
find your triggers, and then also it's disappointing. It can be disappointing. You make a beautiful hypothesis, or even maybe it works for 3 years and then your body changes. For me, my body changed a lot after having a baby. And then you're like, but I had it all figured out before. Oh, so frustrated, So, what do you think about all that?
I don't think that we are machines.
Yeah.
I mean, we have a lot of mechanistic and machinistic structure, and so we can compare ourselves to a car and a robot, up until a certain point, and then it's not predictable. Not everything is predictable. Not everything is understandable. Not everything is solvable, or at least it's not solvable right now. So absolutely, I do think that being human is also, having to deal with the unknown. And absolutely, if you're a chronic illness patient, there's a lot of unknown, and there's a lot of unpredictability. And I don't think that approaching tracking from a control perspective, even though having a sense of control is very important also for people at times, but if you're trying to conquer it, or then that can also get you into a problem with yourself and with the process of tracking, because it can kind of be more stress than it's worth. So,
Yes.
at Mymee, the coaches are always trying to protect their clients from having to experience this, tracking overload. We really try to finesse the tracking process as opposed to, conquer the tracking process. And people, you think by, well, if I do, it's that whole concept. If I do a little bit, then that's good, but more is always better, and more is just not always better. We've probably all realized that on some scale to some extent at some point in our life, but yet we still might think that if I can do it faster, or if I can do it more, then it's going to be better for me. But it actually might be worse for you, because there is such a thing as burnout, and is such a thing as overwhelm, and those are real things that can hurt the process. Certainly during the COVID pandemic, we work with long COVID patients, and there was certainly like an influx of tracking, by certain kind of cultures within the COVID, and COVID patients, long COVID patients, have a lot of symptoms. Like we're talking, upward of 200 symptoms that have been identified now with long COVID, and some of those symptoms are rheumatic, and some of those symptoms are, vascular and circulatory, and some of those symptoms are digestive, and so it's like an overwhelming number of symptoms, and so just by tracking your symptoms is not a solution for your issues either. And so there is a limit to all knowledge. I absolutely believe that there's a limit to knowledge. I mean, we can't know everything, nor does striving to know everything solve all problems, because there still will be unknowns. Like more unknowns will appear every time we ask a question. There's another question asked. You know what I mean? So the most important thing is to be patient and to be compassionate with yourself.
Oh my
when
gosh.
it comes to the process. Yes. I mean, I think in everything that you do as a chronic illness patient, a person with chronic illness, a person who now is going on this journey of, trying to learn things about yourself and trying to contribute to your own well-being and do what you can. Compassion for yourself is like the most important thing.
Oh my gosh, you're completely speaking my language. And I hope that, I think there's a variety of people that are listening to this right now. There are some like newly diagnosed, and then there's people who have kind of been through the ringer, like me, where it's like sometimes you mentioned burnout. I've never really thought of that phrase in terms of like burnout of the job of being a chronic illness patient. But yeah, it is burnout because it's a job to talk to insurance companies. It's a job to track your symptoms. It's a job to manage the day-to-day, so being able to, I've certainly gone through stages of burnout, and I think that burnout can lead people to also denial, oh, it's not that bad. It's not that bad, and kind of a blinders, like, ostrich, put your head in the sand. Like, if I don't think about this, then it won't be real, So, I just think it's great what you provide at Mymee. I'm not saying that I'm not getting paid to say this. I just choose interesting people to come onto this podcast. This is not like by the way, anyone listening, I will always like be upfront if there's somebody on the podcast that I have any sort of like financial relationship with. They're like, I'm not going to be like, I've heard of that. Some of the big podcasts, people are like, oh, they only went on there to like promote their movie. I don't know how that works for like the million people podcasts, but I think what you're providing at Mymee is so great because you're kind of helping. It's like the serenity prayer, right? It's like, help me to control. This is my version of the serenity prayer in summary, is like, control what I can, let go and accept and find peace with what I can't. And like the wisdom to know the difference between those two,
And that's it. I mean, I really think that that's the solution to everything,
Yeah.
but it's extremely difficult. I mean, when you have so few energy reserves and you're focusing all of your energy, more energy than you actually have just to solve for your health condition. I mean, it's very easy to either go into denial or any mental escape that you want to or need to take during that time is absolutely justified. It's completely understandable, which is why it's so important to have people helping you, because it's just so difficult. It's so difficult to navigate, all of this whole world, like at whatever point you're learning about yourself, specialties, your care team, the diseases or any condition, or chasing down a new one, or, you're between diagnoses, or all these things. I mean, it takes so much mental energy, especially if you apply yourself in that way towards it. So, I mean, again, I'm just looping back around to, that's why support is so important. That's why speaking to people who, do have answers you want to hear is really important, because if we're constantly surrounding ourselves, and this is people, our family, our friends, our coworkers, our care team, everybody is constantly telling us that you're not right, or if that's what you're hearing, you're not right, it's not that, it's this, then that in and of itself is harmful, stressful, inflammation creating, exhausting, steals reserves that, you don't have already. If you're like you feel like you're the one person trying to get to the top of this so that you can see off the mountain, and everybody's saying, no, you can't do that. So it's extremely important to find people who are saying, yes, you can do that. That is completely allowed and justified and understandable, and you're right about that. And so that doesn't have anything to do with tracking so much as just
the journey, the hero's journey. That's
yes,
not really a hero's journey. Yeah. I 100%.
It's not a hero's journey. I mean, it's it's a challenging thing to live through. So
yeah, I just say it's not the hero's, or I don't like to say mine is a hero's journey. Not that I don't feel like I'm a hero. Like, yes, we're all heroes, but the hero's journey is one that has an end. You know, you climb the mountain and it has a resolution. And I think it's been important for me to realize that, like, it's more healthy to think of my rheumatoid arthritis and other chronic illness management, like having dysautonomia and like anxiety and other issues, GI issues. It's like, this is just going to be a series of mountains that are going up and down, and some are going to be steeper and some are going to be enjoyable. Then I'll be able to get like a little ride down the mountain on like a fun little, what is the word I'm looking for? Oh, brain fog. What's sled? Sometimes I'll sled down the mountain. Sometimes I'll fall down the mountain, but it's not, I think so many people, this is another soapbox I go on, but they put their life on hold until they can just, till they can conquer, like you said earlier, conquer the disease. And it's, not always in your best interest to do that, I would just say, because thinking of it as an up and down thing is going to prevent that kind of ultimate disappointment a lot of people experience when they realize it's an up and down. Chronic means chronic. Like, well, a lot of times we skip over that. We're like, it's chronic, but I'm going to figure it out. You're like, no, chronic means it's there chronically. Like, but that doesn't mean you can't live better with it, and experience a large amount of, improvement in your quality of life. And it's really a shame that so many people are just basically diagnosed with autoimmune illnesses and then basically told, okay, so this is your team. It's you and a rheumatologist, and come back in 3 months. I'll talk to you for 20 minutes and then you come back in 3 months. And this is nothing. Like, I love my rheumatologist. She's literally like my favorite person. And like, I invited her to my wedding and like all this stuff. But I'm like, no matter how amazing you are, seeing somebody for 20 minutes every 3 months is probably not enough. Like, even if it was, a God, you're like, okay, who's going to help me like on the day to day, so having a team, there's all these amazing professionals out there. There's occupational therapist. Okay, I am biased because I'm an occupational therapist, physical therapist, a naturopath. There's, ophthalmologists, of other providers that really specialize like in the different parts of, the body. And then there's the different psychology, mental health providers. So anyway, please, if you feel like you're on your own, there are so many resources and people out there. So check out Mymee today. Sorry, I'm making it a commercial.
That's funny. No, I think so, I mean, setting expectations, managing expectations, being disappointed, and, these are part of it. And it's okay. It's okay to be disappointed, even though it hurts. I mean, and it's okay to strive for permanent remission. They're both okay. It's okay to, so I think dealing with the overwhelm of emotions that comes along with the pain and the fatigue and all the other kind of systemic symptoms, you do need support. That's why you need support, because it is challenging.
Yeah. And I think I want to highlight again, you mentioned that at Mymee, you help with long COVID. And I think that's really, an amazing resource because it's so new, right? There's so much emerging evidence on long COVID, and there's so few resources out there. So like your organization works on or focuses on lupus, multiple sclerosis, rheumatoid arthritis, like autoimmune illnesses, and long COVID. Am I missing anything else? Yeah. Okay.
Nope. But you don't have to be diagnosed in order to come to Mymee. Certainly people who are on the diagnosis journey, we know it's taking 5 to 7 years for some people to get diagnosed. And for all of those years, they're wondering what's wrong with them, or being told that they're fine, or that their hormones, or, they're just being brushed off a lot of times, unfortunately, when they know deep down that there's something wrong, that there's really something wrong between how they used to feel and how they feel now, what they used to be able to do and what they can do now. And, we're there to help those people as well. But you kind of consider it like the pre-autoimmune. It doesn't necessarily even mean you'll ever be diagnosed with an autoimmune disease, but if you're suffering from like SIBO or chronic fatigue or chronic Lyme, or, some of these kind of pre-autoimmune conditions, and then tracking and identifying your triggers can help with that too. And also, being supported, as I keep mentioning, by health coaches who have been through it. I mean, all of our health coaches have their own autoimmune condition.
I didn't know about that.
Triggers and tracked.
All of
Yeah.
your coaches have their own autoimmune conditions. Wow. Okay. So that's
Mm-hmm.
always a bonus. People
Yeah.
ask me, how do I find like a provider who also has lived experience, whether that's like a health coach or a, psychologist, that kind of thing. People just, there is that level of understanding when you've lived through something, that's amazing.
Yeah, absolutely. I mean, I do not. I mean, there is
Mhm.
autoimmune disease in my family, but I'm also not providing direct client care at
Mhm.
Mymee. I'm really supporting the coaches in, making the recommendations and through the coaching process. And we all work as a team, but each of the coaches who are actually providing the direct client care have gone through their own journey of the ups and downs and finding looking for their triggers and tracking and they've done the whole thing. And we even actually have one coach who became a health coach. She was an RMT before. She went through Mymee as a patient and then she as a client, and she has IBD, but then after she went through Mymee as a client, she became a health coach, and then we hired her on at Mymee to
That's
be a health coach.
amazing.
So it's really a great team, and so thank you for speaking highly of it.
Yeah, and I got to meet in person at the 2022 American College of Rheumatology conference. I got to meet Dr. Nicole Bundy, who is so great. And we both went to Vassar College. We figured out we have all these interesting similarities, and she's just a spark in the world. And so I'm looking forward to having her on the podcast as well. And she has such a unique set of professional and personal experiences, but I'll leave that as a teaser. You have to listen more to find out.
Yes, you must tune into Dr. Bundy's podcast with Cheryl as well.
Yes. Tune in. It doesn't exist yet, but it will. I wanted to just, before we get to the rapid fire questions, do you have time for one more kind of tracking question, or should we move on to the rapid? Oh, okay.
I have time.
So I know nutrition is a big one, and I'm not even going to touch it right now just because I don't think we have enough time, but just know that at Mymee, they have people that can help you with the various variables and tracking for that. But I wanted to talk about exercise and fatigue, because this is one of the trickiest ones, because I know evidence-wise for rheumatoid arthritis, one of the most reliable lifestyle factors that can improve your joint pain and fatigue and quality of life is exercise. But exercise, the word exercise represents, and I'm saying this as a former college athlete, right? A giant variety of things. It could be taking a walk with the dog. It can be running a marathon. It could be powerlifting weights. It could, and I think, okay, the question is, a lot of people have a hard time disentangling the relationship between, let's just say, cardiovascular exercise and fatigue. I personally find that when if I overdo it, if I either push my heart rate too high or push it moderately for too long, I will experience worse fatigue. But for me, I've kind of found a sweet spot for exercise for cardiovascular that doesn't induce fatigue. But what are some tips for people that are I know a lot of people that get discouraged because they're like, I know I'm supposed to exercise, but I feel worse when I exercise. What do I do? So what are some tips?
The first tip is to substitute the word exercise for movement.
Movement. Yeah.
Because it's really movement that is being called for, and it's movement at your pace. No responsible prescription recommendation is ever going to be anything that's overexertional. Actually overexerting is a huge trigger. This always shocks people. They marathon runners, they do HIIT, Pelotoners, and they all of a sudden come down with an autoimmune. I was so healthy, I was doing this great exercise, and then now I can't do anything, and it's very difficult to be in the present where they are, given how fit they were. But having maximal fitness like that is extremely stressful and tiring on the body. And I'm not saying that everybody who engages in the exercise like that is going to get autoimmune disease, but it's extremely taxing on the adrenal glands. And so chronic stress, anything that's overexertional, I mean, it's a big trigger. The literature, the research literature is quite scant on overexertion and as a trigger for autoimmune disease. And yet we know that it's real because we hear it all the time. and the same for COVID as well as autoimmune. And so replace the word exercise with movement, and only do what you feel you can do without needing to rest afterwards. Your exercise should not make you have to, have a day-long nap afterwards. You shouldn't have to recover, push through. The word pushing through, we think it's a champion and it's a warrior, and all these things have been, associated with kind of, have been branded as a way to cope with an autoimmune disease or a rheumatic illness. And that can actually be doing quite a bit of damage for you if you're engaging in anything. Even if it feels good in the moment, it's really just exhausting you too much for it to be worth it for you to do that type of strenuous activity at this time. If it causes you to have to take a day, a week off, definitely if it's causing joint pain, but even if it's causing just fatigue or, needing to sleep it off for a long period of time. It's probably not worth it, especially if it's something that you're trying to implement into your, you're trying to continue to work out despite having, being sick. You do need to treat yourself as a sick person. You need to treat yourself as if you're your own child in order to properly care for yourself. And by getting ahead of your energy and creating some energy reserves, then you will find that you'll be able to do those things without having to force it or push yourself to do something that, is really not going to be good for you over the short or the long term, quite honestly.
Right.
So I hope that was intense. That was like definitely my take on it, and really what we see at Mymee. Like we're always working with people's activity levels and how much they can do comfortably now, because it's much more important to be able to do it more frequently than it is to be able to do it hard. Similar that concept that I was talking about before. More is not better. More is not better. More intense is not better. Being able to sustain what you want to do day in and day out, that is what gets you to a place where you actually can heal and without the need for deep dark periods of recovery, which there's nothing wrong with that. If you need it, you have to do that. So I definitely recommend you recover if you need to, but to get yourself into a place where you have to recover by deliberately putting yourself into some form of intensity that is too much for the moment, I would not recommend.
That's how, I once at one of the trainings for, occupational and physical therapists, the physical therapist brought up the idea of she called them exercise snacks, like a little snack versus a giant meal, and maybe movement snacks. So can you do a little dance break? And, or if you're, in the moment you are confined to your bed, can you do just some leg lifts from the bed? Moving your body against gravity is exertional. Like in occupational therapy school, we learn manual muscle testing, the grades against gravity versus gravity assisted. It's a big, moving your body is exertional. And also the only other thing I would want to say is for people to know, in addition to what you're saying, that, you might also have to look into, if you're trying to even do like moderate activity, moderate movement, and you're just getting just horrible fatigue, you might want to look into ME, or like what used to be called chronic fatigue syndrome, which is now, myalgic, and I always pronounce it wrong, myalgic and encephalomyelitis. And they, that can be, because that's the hallmark symptom of that is post-exertional malaise, so you're going to, if you have that concurrent with rheumatoid arthritis or another autoimmune, illness, you might need to modify even more, do much shorter durations even. But it's hard because it can be, you don't want to get deconditioned, because if you're deconditioned, meaning you lose muscle mass, then your body doesn't move as efficiently either. So it's definitely a delicate balancing act.
Yeah. And so in terms of like practical tips of, if you're looking to strengthen your muscles, I mean, you can do calisthenics, you can simply flex your own muscles. You don't have to be lifting weights or lifting anything. You can use your own body for those things. You can, do squat without holding anything. You can lift your leg from bed, or just flex your calf muscles or rotate your ankles. Anything that feels like it's a slight exertion more than what you normally can do, that you can sustain repeatedly over, 10 to 30 repetitions. But then you also don't need to, sleep for a long period of time or recover for a long period of time as a result of it. But if you're absolutely deconditioned, I mean, again, long COVID clients who have been like, breathless, not able to come out of bed as well, even just deep breathing and strengthening our diaphragm, compressing our diaphragm, for 10 deep breaths, that can be exertional and much more than what you're doing already. So these small movements, walking is the best exercise. And again, a 5-minute walk is better than no walking. And then you can do 5 minutes. You can do 5 minutes. You may get to 5 minutes twice a day. You might get to 5 minutes 3 times a day. You might be able to extend to 20 minutes at once, and you build it up gradually. And that's really the key to conditioning yourself back to a place where that you're happy and comfortable. So it's a gradual, just like everything. It's best to move in gradual and be with yourself how you are now.
Oh gosh. Yeah. I'm reminded of my cousin. I was going to say, I don't know why I said husband. My cousin ended up getting hospitalized. He had that thing that happens when you try to exercise too fast, where your muscles break down and like hurt your kidneys. I forget what it's called, but yeah, he was like former big athlete and tried to just jump right back in. Like, I'm getting into shape this year, and I'm laughing, but it's actually really, really serious condition that he ended up getting. So it's, start low, go slow. I think those are great. Those are great tips. And yeah, people always think about strength training as needing weights, and you're certainly right. Doing, a wall sit can strengthen your quads, doing calf raises just against gravity or on a step. There's so many things you can do with what's around your home.
Chair pose, boat pose, like mild yoga movements, slight Pilates movement. There's access on YouTube to all of these things. You don't have to pay to get access to small movements. And so small movements, I would say, is key, especially if you're highly debilitated at the moment, and you can build up from there.
Yeah. Something I remember learning in OT school, I don't know if maybe you can tell me if this is wrong, but is that you're born with all the muscle fibers you're going to have. It's just that they get bigger or smaller. I thought that's kind of like a beautiful thing to think about. Like, okay, even if I'm deconditioned, meaning like my muscle strength is lower at the moment than I'd like it to be, I'm like, well, you can always, you have the fibers are there. We just need to kind of work them a little bit, they didn't disappear, hopefully, unless you had like a major injury.
Yep.
But yeah.
And oddly, muscle fibers tear and repair, right? That's how they get stronger. So you just do small stretching and contraction movements to stretch them and tear them a little bit, and then they repair stronger than they were before. And you can get reconditioned very quickly also, if your body allows for it. So.
Yeah. Well, thank you. That was helpful. So just a few last rapid fire questions before we wrap up. What are some words of wisdom you have for people maybe newly diagnosed with an autoimmune illness or similar challenge?
I always go back to taking care of yourself first. I mean, I think it's you can spend so much energy looking outwards and trying to find answers and solutions, and that can be important and a good task to take on over the long journey. But you really want to be checking in with yourself all the time and asking yourself if you have the energy to do this right now, and speaking to yourself kindly. You really want to take care of and be the nurturer for yourself. You really need to be a nurturer for yourself if you're just diagnosed, and it's extremely important. And, no matter who you are, you need to speak to yourself kindly and compassionately.
I love that. I love that. And do you have a favorite mantra or like inspirational saying, either for you or for your patients?
You don't have to know it all. You don't have to know it all. You can accomplish a lot you don't need to learn the next thing. You know enough now in order to do yourself good.
Love that.
Yeah, I think continually striving for knowledge. I mean, I'm a person who did spend a good portion of my life continually striving for knowledge and think, oh, if I just knew that, or if I just took this course, or if I went to that school, or if I did,
Yeah.
but no, you can stop at some point and rest and collect what you have right now, and it's good enough to help yourself. And I think sometimes just tuning into the wisdom that you do have is more important actually than learning what that person has to say or what that person has to say.
I love that. And what's something that's bringing you joy right now? Could be something in your life, or it could be a book or a show.
My puppy, I mean, he is a handful. He's
Yeah.
had he's had chronic giardia since I got him, but he's like
Oh,
just so we've had to yeah, so we've had to manage chronic diarrhea
oh
for months,
no.
and he's 8 months, but he is the best like little guy to wake up with, and so he's
Oh,
definitely bringing me joy. Yeah.
oh my gosh. Yeah. My dog just turned 4 years old and I still call him my puppy and he still brings me joy.
Yeah,
Yeah. And,
they're so fun.
yes. And what, this is kind of like a meaning of life question, but what does it mean to you okay. What comes to mind when I say the phrase like thriving with rheumatic disease or thriving with autoimmune disease? What does it mean to thrive with those things?
Um, what I hear from patients is that they continually have epiphanies about their experience.
Mm,
So when they know they're on the right track towards finding, just answers for themselves or getting to know themselves better, or, something's improved, there's always like a light bulb moment, and people can have
mm,
repeated light bulb moments. So I think when you're having light bulb moments, you're living well
I love
because
that.
you're learning about yourself. Yeah. Being
Little
inspired.
epiphanies. Yeah.
Yeah.
Awesome. And is there anything else you want to share before we conclude?
Well, I just want to say that the world of tracking, it's very big, and there is a way to get better at it, and it can be. There are a whole lot of factors in autoimmune disease that are not controllable, some, and
Mhm.
not modifiable. Some things are not modifiable. Like maybe we can't clean up our environment. Maybe we, the train spill. I mean, people are sending me so many articles on the train
Oh,
spill and the chemicals that have been released. And, we can't do, we are impacted by our environment, and our immune system is impacted by our environment. But, all the modifiable things, whether it's the way we move, the way we sleep, the way we breathe, the way we talk to ourselves, the way we think about our life, the way we
mm,
engage socially, who we choose to have around us, what we do for work, like all of these things are modifiable. And by opening ourselves up to new possibilities, um, even if it's hard, to break through. But this
yeah.
is how epiphanies are created for people, is keeping an open mind
Mm.
as opposed to thinking like, I can't do this. Like, there's so much I can't do this. And so we keep ourselves kind of imprisoned by our thinking. And so when we are feeling inspired by what our tracking is showing us, then we're on the right track. It's not
Yeah.
about being perfect at tracking or tracking everything or tracking every moment, but it's about following the threads that are informing us that, we're feeling better, and we got an answer. We got a good idea there. And then that was satisfying. And so those satisfying moments are really important when you're trying to empower yourself towards improving your symptoms, and hopefully going into remission when you have an autoimmune disease.
Yeah. Yeah. I love that. I often talk about the things that are like controllable or outside our control, but I like the idea of modifiable because it kind of suggests degrees, right? Because something can be modifiable, to a certain degree. And it's just I like it. So I'm glad that you introduced me to that concept of modifiable variables. And yeah,
Right. Yeah, because it's not all or nothing. I mean, that's
yeah,
and even food reductions, eliminations, food triggers, all these things that everybody's afraid of them. They're scary. You don't want to lose your favorite foods, but sometimes it's just tweaks. It's not
yeah.
the whole shebang. Or if it's the whole shebang, it's temporary. So you can get to a place,
Yes.
you can build on successes, you can build on wins and get to a better place. And so I do want to encourage people that there are people who are doing that, and you can do it too.
Yeah, absolutely. And I will post links to Mymee and to your social media and to the Mymee page. I love what is shared on the Mymee Health, Instagram. And I'm just really grateful for your time. I know you're very busy being the head of coaching at Mymee. So thank you so, so much for tackling this topic with me today.
Thanks for having me, Cheryl. It was fun.
Yay. Okay. Bye-bye for now.